Hello everyone, and welcome to today's talk. As we grow older, many of us begin to notice that our bodies don't quite move the way they used to. Some people wake up with stiff knees, others experience chronic back pain or aching shoulders, or maybe it just feels harder to get around than it used to. These may seem like small inconveniences at first, but over time they can greatly affect our quality of life, making it difficult to walk, sleep, or even enjoy daily activities. What you're feeling may be the signs of age-related joint and bone problems, a common but often misunderstood issue for seniors. So in today's talk, we'll take a closer look at what joint problems in the elderly actually are, why they happen, and most importantly, how we can prevent and manage them in everyday life. First, let's talk about what's happening inside the body as we age. The human body is an amazing system, but just like any machine, over time it begins to wear down. Around the age of 40 or 50, the cartilage in our joints, which acts like a cushion between bones, starts to thin out. The joint fluid that helps things move smoothly decreases, and bones lose density, becoming more fragile and prone to fractures. This gradual breakdown leads to conditions like osteoarthritis, osteoporosis, inflammation of the joints, and even bone spurs or spinal issues. But aging alone isn't the only cause. There are many lifestyle factors that make joint problems worse. One of the biggest causes is lack of movement. Many seniors become less active after retirement or due to limited mobility, but joints need movement to stay healthy. Without regular use, joints become stiff, muscles weaken, and circulation slows, which leads to more pain and less flexibility. Another factor is poor nutrition, especially a lack of calcium and vitamin D, which are essential for strong bones. Many older adults eat very simply, skip dairy or green vegetables, or don't get enough sunlight. As a result, the body can't absorb enough calcium, which leads to silent bone loss over time. Excess weight is another big issue. When we're overweight, especially with belly fat, it puts extra pressure on joints like the knees and hips. That speeds up cartilage wear and causes chronic pain during movement. Then there's poor posture, something we often overlook. Sitting hunched over, watching TV in bed, bending the wrong way while lifting things. These habits can misalign the spine and put uneven pressure on joints, causing pain and long-term damage. We also can't ignore genetics and underlying medical conditions. If your parents had arthritis or joint inflammation, you may be more likely to develop it too. Conditions like diabetes, gout, or autoimmune disorders can also affect joint health. So now the question is, can we prevent joint problems or slow them down? Yes, and the good news is, it doesn't require anything complicated. Just small, consistent changes to daily habits can make a big difference. The first and most effective habit is gentle daily movement. You don't need to go to the gym or run miles. Just a 15 to 30-minute walk each morning, or some light stretching, yoga, or Tai Chi. That's more than enough to improve joint flexibility, increase blood flow, and strengthen the muscles that support your bones. Next is a balanced diet that supports bone health. Include foods rich in calcium and vitamin D such as milk, yogurt, sardines, leafy greens, tofu, and eggs. Avoid overly salty, sugary, or greasy foods, and limit alcohol or tobacco use, which weakens bone density. Keeping a healthy weight is also critical. Even small weight loss can reduce the pressure on your joints and relieve pain. You don't need to diet harshly, just eat mindfully and move daily. Another key habit is practicing good posture, whether sitting, standing, or lying down. Always sit with your back straight, don't slouch while using the phone, and avoid bending your back too far when lifting objects. Use proper technique and support your spine. Finally, make sure to get regular health checkups, especially bone density scans after age 50. Early detection of osteoporosis or joint degeneration allows for better treatment and long-term management. Dear friends, we may not be able to stop time, but we can take care of our bodies to make aging more comfortable and independent. Strong joints are the foundation for a happy, active life. Even small steps like daily walks, better nutrition, posture awareness, and regular checkups can help us maintain our independence, reduce pain, and enjoy life with our loved ones for longer. Thank you so much for listening. If you found this talk helpful, please consider sharing it with others who might benefit. Let's help each other age with strength, wisdom, and grace. Wishing you good health, peace, and happiness always.